Are you undergoing treatment for back pain and wondering how long it might take you to fully resolve the issue? Watch this video to find out the answer. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the care and treatment of other people, perhaps like yourself, who also suffer from back pain. So as a person undergoing care for your back pain, the obvious question of when is your treatment complete does need to be answered. After all, we're always balancing those important considerations, those valuable resources of time and money. And of course, no one wants to be going in for care and treatment after it's lost its value or effectiveness. Now, it's most common for people to perceive the end of their treatment as when their primary concern, usually pain, diminishes or ends. So you experience some pain in your back, you come in for treatment, you have a few sessions, and once pain has subsided, that's when treatment ends. However, this misconception that treatment ends with the cessation of pain is akin to plucking a weed without extracting its roots. So, in this intricate realm of musculoskeletal health, back pain, the root cause of an issue often lies far deeper than the manifested symptoms. What we do find is that when people focus solely on symptom relief, pain relief, without fully addressing the underlying factors, this can pave the way for the recurrence and worsening of the injury, which often renders the initial treatments insufficient. In reality, best results, particularly in the long term, are achieved when the true scope of rehabilitation is understood and fully engaged with. In this model, the cessation of pain is seen for what it truly is, a valuable step along the path to full recovery. So of course you might ask the very reasonable question, when then is my treatment complete? Does it just go on forever? Or is there a point where things end? In my opinion, full rehabilitation is achieved when three goals have been met. Firstly, I want to see no more pain. Secondly, I want to see no more movement dysfunction. And thirdly, I want real-world challenges to have been exposed and managed. So the first phase or the first step, no more pain. This one's fairly explanatory. Most people will come into a back pain clinic or a musculoskeletal clinic because they have some sort of pain that they want to get rid of. This might be pain that's always there sort of throughout the day, or pain that's only there with certain movements that you need to do. Once that pain is gone, this phase is complete. Fortunately, this phase of the treatment, depending on the condition, is normally relatively short, on average, depending on what people are experiencing, around 2 to 6 weeks. And the treatment frequency is normally a little bit higher, normally either a session a week or perhaps 2 sessions per week. The second step or phase, no more dysfunction. This is what I call getting to the why of the injury. If you have shoulder pain, if you have elbow pain, if you have back pain, why do you have it? Now, obviously, some injuries do have a clear, acute, traumatic cause. So, you fell off your bike and dislocated your shoulder, you stepped in a pothole and rolled your ankle, you got kicked in the ribs and one of them broke. In these cases, the why is very, very simple to answer. You got unlucky somehow, you had some sort of accident, and you need treatment to help you heal and recover. Unfortunately, most injuries that we see in clinic are not clear, acute, traumatic injuries. They are the result of some period of time of repetitive, abnormal loading of a part of the body that eventually starts to become a problem. So in this case, the why becomes both more complicated, but also much more important to discover and address. This is especially the case with back pain, where traumatic injuries really are the exception rather than the rule. Most back pain is what we call habitual, where bad habits have become normalized over time, eventually leading to pain and dysfunction. In back pain that is habitual rather than traumatic, if we stop treatment when pain ends, all that movement dysfunction, bad habits, and postural issues that were the cause of the back pain remain. So to go back to my earlier analogy, we've pulled out the weed, we stopped the pain, but the roots remain. So recurrence of injury is all but inevitable. In this second phase of treatment, we seek to understand and address the movement dysfunctions, habits, and postural issues that led you to have the back pain in the first place, giving you the best chance of prevention of recurrence of injury. Now, this phase of treatment may last a little bit longer than phase 1, normally, depending on the condition, something between about 4 and 12 weeks. However, frequency will be reduced, normally something like 2 to 4 sessions per month. The final phase, phase 3, real-world challenges need to be exposed and addressed. So this is where patients often make the very understandable mistake of saying, okay, well, I'm out of pain and we've addressed my movement dysfunctions and bad habits. I guess I'm good to go, right? I'll call you if I experience any issues. There are 2 main issues with stopping treatment at this point. The first is that it's almost inevitable that people will regress, at least to a certain extent. So after the initial enthusiasm of treatment, what we find is people will do their maintenance exercises less frequently, or maybe stop paying so much attention to their habit changes and their postural changes. This can cause those poor movement patterns and bad habits to resurface, especially if they were there in the first place for a very long period of time. The second reason is that there is an unfortunate limitation in the clinic room or the rehab space, and that is that we are only really testing what you are doing in the confines of the clinical space. Now, we try to simulate the real world as much as possible, but of course, we are just seeing what you're doing that day, for that period of time in the clinical space. So at some point, we need to test the changes and adjustments that we've made in the real world. Essentially, you need to go away and live your life the way you want, engaging in all the activities that you intend to continue engaging in. And we need to see if everything we did in the treatment room holds up against those real world challenges. If continued monitoring occurs during this period of return to normalcy, any issues that might arise can be identified and addressed immediately before they start to become problems. This is where the skills of observation and assessment of your clinician become invaluable, because they'll be able to see things before they start to become problems. In this phase, the overriding thought or the overriding phrase will be, an ounce of prevention is better than a pound of cure. Now, this phase is normally the longest in terms of contact time, often lasting, once again, depending on the condition, from about 3 months to about 12 months for really serious conditions. However, the frequency will be significantly decreased, with contact time being, a maximum twice a month, maybe once a month, and then decreasing over the period of observation to maybe once every 2 or 3 months. So contact length is longer, but contact frequency is significantly reduced in this phase. In my work with patients, I try to emphasize the extreme importance of not just managing pain and other symptoms, but embarking on a journey to uncover and resolve the root causes of your back pain. The changes made then need to be tested in the real world and modified as necessary. I realize that this process may seem a little onerous when compared to the current standard, often very unsuccessful model of care, where treatment stops at the cessation of pain symptoms. However, when the clear risk of injury recurrence is taken into account, it is a far more efficient and cost-effective way of dealing with your issue. If you follow this process to its completion, you will complete your treatment not just back to normal, but in a better position than in your pre-injury baseline. Does that sound appealing to you? I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you like the video, please give it a thumbs up and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your road to recovery. Thanks again for watching, and I'll see you in the next video.